So let us start the class. Okay. I will take your first aid theory for now. That day we have started the class on hemorrhage, right? Hemorrhage or bleeding. So I guess you all know what is the meaning of hemorrhage, right? Do you know what is hemorrhage, Tanugurung? Tanugurung, unmute yourself and tell me. What do you mean by two connected devices? Who is connecting again? What do you mean by hemorrhage, Tashi Somu? Tashi Somu, unmute yourself and tell me what do you mean by hemorrhage?
Ma'am, hemorrhage or bleeding is of blood from an artery, vein, or the various.
Okay. Arteries carry oxygenated or deoxygenated blood? Say fast.
Oxygenated.
Okay. And veins carry?
Deoxygenated.
Okay. And what do you mean by capillaries? What do you mean by capillaries?
Tiny blood vessels.
Okay, okay. Okay, so what are the types of hemorrhage? Subhash, you tell me, what are the types of hemorrhage? Subhash is there?
Yes, ma'am.
Okay, please tell me what are the types of hemorrhage? Say fast. Today my network is a bit slow,
Upper
okay? You
head,
will have to
eye,
adjust with this only. See, what are the types of hemorrhage?
upper head, eye, upper head, eyes, urine tract,
What? I asked you the
urine
types of hemorrhage.
tract. Yes, ma'am.
What are types of hemorrhage?
Upper head, eyes, nose, mouth, lungs.
Array, types of hemorrhage, how can it be heart, lungs? Srijana, what are the types of hemorrhage?
Arterial bleeding, venous bleeding, and capillary bleeding.
Okay. And in arterial bleeding, does the blood spurt? Does it spurt? Or it doesn't spurt? Yeah, in arterial, does it spurt or it doesn't spurt?
It spurt.
It spurts at each contraction, right? And what about the color of blood in venous?
Dark red.
And in capillary?
Red.
And in arterial?
Red.
Okay. In arterial, it's bright red. Okay, bright red, dark red, and the other is just simply red. Okay. Okay, so John Deep, you please read out effects of hemorrhage. John Deep, effects of hemorrhage. Side point us, no. Please read out. Please read out fast, John Deep, effects of hemorrhage. John Deep, you don't have the answer.
No.
No.
Oh, yes, yes. Effects, types.
Effects of hemorrhage. Effects. Not the types. Effects. I've given you 4 points. Read out.
Intracranial hemorrhage, bleeding in the skull.
No. It effects নহয়. Kajal. Kajal, please read out. Effects of hemorrhage. Okay. And for section A and B, Saurav and this one, please write down the names. Please read out.
Sorry, seven.
Okay. Kajal, please read out the effects of hemorrhage.
Okay, ma'am.
Ma'am,
The loss of red blood cells causes lack of oxygen to the body system. Second point, the decrease in blood value causes decrease in blood pressure. The heart's pumping rate increase to compensate for reduced blood pressure. The force of the heartbeat is reduced since there is less blood to pump.
Okay. And did I start with the special effects? Aims of management is there, in general management is there, right? So let us start with the special forms of bleeding. Did we start the special forms of bleeding?
Yes, already.
Okay. Bleeding from the scalp is over, right? Is it over? Bleeding from the scalp. Treatment. Did I give you the treatment?
Yes, ma'am. Treatment already also done.
Okay. So number 2, you write bleeding from nose. The first one was bleeding from the scalp, right? Number 2, you write down bleeding from the nose. Bleeding from the nose, number 2. Write down. Bleeding occurs from the... Likha, Jondeep, start writing. Number 2, bleeding from the nose. Bleeding occurs from the blood vessels. Bleeding occurs from the blood vessels.
From the blood vessel.
Blood vessels inside the nostrils. Inside the nostrils. 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 Okay, so inside our nostrils there are tiny blood vessels. Okay, full stop. Then you write bleeding coming from nose. Bleeding coming from nose.
Bleeding coming from the nose.
Is also a sign of... Bleeding coming from the nose is also a sign of fractured skull. Is also a sign of fractured skull. So whenever there is a fractured skull, there is a possibility of bleeding from the nose, okay, which is inside the blood vessels, tiny blood vessels that are present inside your nostrils, okay. Skull, full stop. Then you write signs and symptoms. Bleeding coming from nose is also a sign of fractured skull. Fractured skull, this is your skull, your head. Okay, fractured skull, SKUSS, skull. Then you write the sign and symptoms. Write down the sign and symptoms. Sign and symptoms. Number 1, you write moderate flow of blood from nose. Moderate flow of blood from the nose. NOSE, nose. Moderate means? What do you mean by moderate?
Of the blood.
Sakani Dabyang, what do you mean by moderate? Anyone? Moderate flow of blood from nose. Moderate means what?
Average is amount. Since quality we work moderate. Average.
Saurav, Dev Barma, what do you mean by moderate? Saurav?
Normal and regular flow.
Huh?
Hypertension from
Yes, Saurav?
while
Saurav, please unmute yourself and tell me. KV, what do you mean by moderate? KV? Uh-huh. Neither less nor heavy. Okay. The flow of blood will be moderate. It will be in the middle. Okay. What do you mean by moderate temperature? Moderate temperature means neither hot nor too cold. Okay. So moderate is always in the middle. So the blood flowing from the nose will be moderate. Okay. Number 2, you write, if skull fracture is there, if skull fracture is there, if skull fracture is there, then if skull fracture is there, if skull fracture is there, then mixture of MIXTURE, then mixture of blood and clear water, mixture of blood, 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 and clear watery, WATERY, clear watery cerebrospinal fluid comes. Clear watery cerebrospinal, CEREBROSPINAL, cerebrospinal fluid, FLUID, fluid comes, COMES comes. Full stop. Clear watery cerebrospinal, CEREBROSPINAL, cerebrospinal fluid, FLUID, cerebrospinal fluid comes, COMES comes. Next, you write down the treatment. Treatment, you write, sit the casualty down. Treatment number 1, sit the casualty down. Sit the casualty down. CASUALTY, sit the casualty down. With the head well forward, with the head well forward, WELL, well forward, FORWART, well forward, and loosen, LOOSN, and loosen any tight clothing, tight clothing, TIGHT, tight clothing, 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 around the neck and chest, around the neck and chest, neck, NECK, neck and chest, CHEST, chest. So what you will have to do, you will have to lead the casualty sit, okay, and you will have to tell him for his head to be forward, means in this position, okay. He should be sitting, head should be a bit downwards, forward, okay, but it should be a bit down so that the water drops can come out properly, okay, because there won't be only blood, but there will be a mixture of CSF fluid also along with blood, so you will have to let those things come out, okay. And also, if any tight clothing is there, okay, if he's wearing a shirt and then pura it's tightly tugged tightly, if the short buttons are too tight, you will have to help him loosen the short button. If he is having a full sleeve, you will have to fold it up, okay. So how much possible you will have to have so that he can be able to breathe in and out properly, okay, without any exhaustion. Number 2, you write, advise him to Advise, ADVISE, advise him to breathe through the mouth. Advise him to breathe, BREATH, breathe through the mouth, 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 and to pinch, PINCH, pinch the soft part of the nose. Advise him to breathe through the mouth and to pinch the soft part of the nose. Okay. After that, what you will do, you will ask him to breathe in through the mouth. Okay, instead of breathing through the nose, ask him to breathe through the mouth, and you just have to pinch it. The soft part of the nose is this. Okay, you will have to just ask him to pinch it. Okay. Then number 3, you write, tell him to spit out. Tell him to spit out, SPIT. Tell him to spit out any blood in the mouth. Tell him to spit out any blood in the mouth, 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 comma, swallowed blood may cause, swallowed blood. Tell him to spit out any blood in the mouth. Okay, inside the mouth, if there is any kind of blood, you will have to ask him to spit it out. Okay, comma, and then you write swallowed blood, swallowed, SWALLOWED. Swallowed blood may cause nausea and vomiting. Swallowed blood may cause nausea and vomiting. Nausea, NAUSEA, nausea and vomiting. Okay, so whatever remains of the blood are there inside the mouth, you will have to ask the casualty to spit it out. Okay, means to take it off. You have to ask him to spit it out. So why? Because the swallowed blood, okay, if by chance he swallows inside, it might lead him or it might cause him to vomit. Okay, vomit, puke, or else nausea. Nausea means vomiting means you already vomited, it already came out. But nausea means it is a feeling. Okay, you are feeling like you are vomiting but it didn't come out. Okay, but it's just a feeling. So you will have two sensations, one is nausea and the second one is vomiting. Next point you write down. Next point you write down. Release the pressure after 10 minutes. Pressure means which pressure? You have asked him, right, to pinch the nose. So the soft part of the nose you have asked to pinch. So after 10 minutes you will have to ask him to release. Okay, release your hands. Release the pressure after 10 minutes. Full stop. If the bleeding has not stopped, even after that, okay, even after allowing pinching and all, if it's still going on, then what will you do? If the bleeding has not stopped, continue treatment for a further 10 minutes. Continue treatment for a further 10 minutes. Continue treatment for a further 10 minutes. Even after doing all of these things, if the procedure is not effective, the patient or the casualty, what would you do? You will have to continue the same treatment for another 10 minutes. Okay. Full stop. Do not allow the casualty to raise the head. Do not allow the casualty to raise the head. Do not allow the casualty to raise the head. HEAD, head. Full stop. Next point. Number 4 point you write. While the head is still forward. While the head is still forward. While the head is still forward, comma, gently clean around the nose and mouth. Gently clean. See, it means you should not be harsh. Okay, you should be very much gentle. Gently clean around the nose and mouth. Using a swab. Swab means alcohol swab. Okay, using a swab or clean dressing. Using a swab or clean dressing, CLEAN, clean dressing, soaked in lukewarm water. Soaked in lukewarm water. soaked in lukewarm water. And how will you clean? With an alcohol swab, okay? Or else if it's not there, then you could just take a bowl of water, okay? But the water should neither be too hot nor cold. It should be in the middle, okay? Lukewarm water, and then you will have to gently clean the nose and the mouth, okay? The next point.
Ma'am, rising soap.
Hmm?
Ma'am, clean rising.
What?
Repeat again. Repeat again.
While the head is still forward, comma, gently clean around the nose and mouth using a swab. Okay, using a swab or clean dressing soaked in lukewarm water. Soaked in lukewarm water. Full stop. The next point you write down, when the bleeding stops, when the bleeding stops, comma, when the bleeding stops, comma, tell the casualty to avoid exertion. EXERTION. Tell the casualty to avoid exertion. Full stop. Next you write, advise the casualty not to blow the nose. Advise the casualty not to blow the nose. Blow, B-L-O-W. Blow the nose for at least 4 hours. For at least 4 hours, so as not to disturb the clot. So as not to disturb the clot. C-L-O-T, clot. Not Kapoor cloth, okay? I'm saying about cloth, blood clot, C-L-O-T, clot. Okay, so you will have to ask the casualty not to blow his nose. Whenever you have sardi khasi, what happens? You used to blow your nose, right? To take off the dirt. So that thing should be avoided. You will have to ask him to avoid, because if he takes too much pressure while doing that, the blood cord may rupture, which may again lead to excessive bleeding. Okay, at least for 4 hours or more than that. The last point you write down, if after 30 minutes the bleeding persists, if after 30 minutes, means after half an hour, okay, if after 30 minutes the bleeding persists, 30 minutes the bleeding persists, persist means what? If the bleeding still continues, what will you do? Okay, persist or recurs, R-E-C-U-R-S, comma, seek medical aid. Seek medical aid, MEDICL, medical aid, AID, seek medical aid. Okay, even after doing so much treatment, if you are not possible to do it by yourself, the last option is you will have to take him to the hospital. Okay, next, number 3, you write down bleeding from ear. If there's any kind of bleeding from the ears, write down number 3, bleeding from ears. Then you write, this occurs during skull fracture. This occurs during skull fracture or rupture of eardrum. Inside your ear, there are eardrums, okay, through which you are able to hear. Fracture or rupture of eardrum, eardrum, DRUM, drum, comma, or from external ear wounds. If there is any kind of wound in your external part, okay, not internal means your eardrum will come, but external means maybe around the sideways or maybe around all these soft muscles, okay. If there's any kind of external ear wounds, then there might be bleeding from ear. Next, you write the sign and symptoms. Number A, sign and symptoms, number A, small a, and you write down if from the eardrum. Small a, if from the eardrum. If it's from the inside, if the bleeding is from inside your eardrum, okay. Bulletin, start the bulletin and write pain inside the ear. First bulletin, write down pain inside the ear. You can just put a dot, okay, bulletin. First bulletin, pain inside the ear. Okay, it's obvious that if there is any kind of bleeding from the eardrums, obviously the first thing will be pain. Okay. The second point you write down, deafness. Second point you write down deafness. DEAFNESS, deafness. Third point you write down moderate flow of blood from the ear. Moderate flow of blood from the ear. Number B you write down if from within the skull. If from within the skull. If from within the skull, SKULL. The first bulletin you write down history indicating skull fracture or head injury. History indicating skull fracture or head injury. If there is any kind of previous history, okay, in the past history, whether if there was any kind of skull fracture, head injury, that can also be a cause. Number second one, headache. Second point, headache, Murorbic. Okay, headache. The third point, third bulletin you write, small amount of blood mixed with, small amounts of blood mixed with, small amounts of blood mixed with clear, comma, clear, 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 comma, watery, WATERY, clear, comma, watery, cerebrospinal fluid, cerebrospinal fluid, full stop. Cerebrospinal fluid, full stop. The last point you write unconsciousness. The last point, unconsciousness. Unconsciousness. Okay. The treatment part, I will just continue in my next class. Okay. Because my remaining time is only 1 minute. It might just go. So you join after some time again. Okay. I will be again taking a class. Okay then. Thank you. Thank you.
Thank you, ma'am.
Give me the attendance.
Thank you, ma'am. Thank you.